Hello dear students, now I know some of you have given the AIIMS exam in the November, some of you have not given the AIIMS exam in this November because you were eligible for the next exam, some of your final years, third years, and after a significant exam like AIIMS is done, there is a curiosity in everybody's mind that what was this exam all about and what should a future aspirant think about when he is appearing for the, suppose you're appearing for the May 2020 AIIMS exam. What should be in your mind when you evaluate the previous paper? So we have drawn an analysis based on the recall that we discussed with the students who have appeared for the exam. Based on that recall, I have now created a small assessment of what the paper was all about so that you get an idea on how to prepare for the future exams. So let us start with the basics. The foremost thing that everybody was pointing about, anybody who gave this exam, the foremost thing was time management. Time management means, you'll be surprised as a future aspirant for AIIMS. You might be surprised that, sir, it is just 200 questions. Why time would be a challenge? But when you give the actual exam, in this exam, there are questions of multiple patterns. Because of those multiple patterns, the effective number of questions tends to go up. So the question will say 200, but in the question palette when you're marking, the actual number was this time 288. Because there are questions where multiple answers are correct, there are multiple true and false, there are questions like match the following, there are questions where you have each choice has to be read separately and marked as an answer separately. So in effect that becomes 5 questions. So the key to remember is that you might be thinking that this is like a NEET exam is of 300 question, AIIMS is of 200 question. You might think that the time management would not be an issue, but remember in this AIIMS, just like when some of you would have appeared for the mock test that we conducted, AIIMS mock test that we conducted in DAMS, the effective number of questions will go up. So when you are marking in the question palette, this time the total number was 288. And that is the key to time management, that if you miss out on this idea that you have to be on the word go, from the word go, you have to start at a good pace. If you miss out on that, you will screw up the time management part. If you don't finish your paper, I know candidates, I know, children who have not been able to do match the following or who have not been able to do 1 or 2 components because of improper management of time. So this is one of my first message to be, a future AIIMS aspirant is time management. Don't forget that. Okay. Second is, I'll share with you the distribution that I have been able to find out by interacting with, scores of students after the exam. The total number of questions out of 200, 150 questions were single best response. This was same as what was there in the May exam as well. So this looks like to be the pattern that they're going to continue, because in the 2 exams they have maintained predominant number of questions were single best response. Out of 200, 150 were single best response. And in these questions, the marking scheme, the negative marking scheme is 1 by 3. So you get +1 for a correct answer, -1 by 3 for a wrong answer. But this is the main determinant of this will form the backbone of your score, single best response. Don't ignore them, because in the rush for new patterns, sometimes we forget that predominant questions would be single best response. I want to, give you a reminder on that. In this paper, there were 10 questions on assertion reasoning pattern, 10 for multiple true false. Okay, 10 for multiple true false, 10 for multiple completion type. So assertion reasoning were 10 questions, which is a significant number. Multiple true false were 10 questions, which is a significant number. Multiple completion time 10. So 30 out of 50 were these. 12 questions were match the following, which is again a significant number. Theme based extended matching was only 3 questions. So sometimes you might think that, what is the distribution of those 50 questions, and 5 were arranged the following in sequence, where the negative positive ratio was +1 -1 for this kind of question. So if you notice again, the predominant type of questions here to me are match the following, which is not really too difficult. It's just simple facts to be matched, and that gives an element of factual questions in the exam. There are questions like multiple completion type, multiple true false, 10, 10, 10, and look at assertion reasoning on the top 10. These are very, very important, very important questions for you. So this is how the paper was distributed. But there is another element to the paper which I want you to understand, which makes AIIMS exam different from other exams. and that was image-based questions. There was a significant number of image-based questions in the paper, and in image-based questions there were two kind of questions. In one of the questions you had a history or a question and an image, and you had to put them together to get the answer. But there were some questions where there was a history and a question which was enough to make the answer. Image was just there just to maybe, take your time to confuse you, but actually it was not contributing to the answer. So the paper was visually very rich. So that is different from other exams that you appear for. Other exams that you appear for, you will feel them to be theory rich. In AIIMS it was very visual exam. And not only it was visual in 2 dimensions, there were video based questions also, which was same as, in the May exam also there were video based questions. In the November AIIMS exam also there were video based questions. These are tiny graphics which you have to look at them and then answer. So that introduces that interactivity in the exam. So that is where, you will hear, all the toppers, all the good rankers would keep saying that it is about your common sense in the exam, because you have to, put things together in the exam. It is not like a rote learning exam. It is, the AIIMS traditionally has never been a rote learning exam. It has always been about, your presence of mind on the day of the exam. You have to build it up by, going through the exercises earlier, by doing practice, tests, everything. You build it up so that on the day of exam, you don't get confused by a visually intensive paper. There was a good number of visual questions. There were a good number of video questions. So that makes the exam different from what you traditionally appear for. What else? In this paper, there were 3 ECG based questions. So again, ECG has been a question in AIIMS which is touch and go. Sometimes they put questions, sometimes there are no ECG questions. This time there were 3 questions based on ECG. And I'm very happy to share with you that all of those were covered in our classes, covered by the teachers, covered in the AIIMS capsule. We're really proud of that thing. So ECG. Emergency is an important theme for AIIMS. Even for this exam, emergency was an important theme. And we are, I'm again, you might say, sir, so I'm so happy. I'm really happy about it that we created a special course called as Emergency Medicine on eMedicos, where we could, cover a lot of things. And, I'm happy to hear the feedbacks also. The students were very happy with the way we structured the course. Surprise for this time was that in PSM there was no biostatistics, no problem-based question, which are usually there in AIIMS. So, but for a future aspirant, it is important to see that all they are trying to do is juggling up things so that you don't predict that this would always be there. Maybe next time they might be putting some biostatistics, who knows. So it's a good idea to have that global picture in your mind. Don't be biased by it. This time they're surprised by putting no biostatistics, no problem-based, no calculation-based question. Okay. In pathology, the hematology, general pathology, and blood transfusion. Many people forget blood transfusion, but this was one of a very important topic in this AIIMS exam. In surgery, the questions, classically they would only look at the general aspect of surgery. This time they have gone into clinical procedures, clinical questions into the paper. So that was a change from a classical AIIMS approach. In anatomy, there were questions which had images of limbs, and the dissection based images were there, and which is slightly tricky if you look at them for the first time, but if you, form understanding, you will be able to do them. Usually in AIIMS, in OBS and gynae, they put more gynae than OBS. This time it was more OBS, less gynae. In physiology, the predominant topics that they had stressed upon were nerve, muscle, and respiratory medicine. In pharmacology, the unique thing that was done in this paper was they took the concepts of general pharmacology and they integrated those concepts with the systemic drugs. So there was a drug, but the answer was based on general pharmacology. So if you had an understanding here, you found them easy. In orthopedics, they have gone for things like image-based questions, clinical tests, and instruments. And people really, really appreciated the way in our classes we build orthopedics in a clinical scenario-based discussion. And that was the exact theme in the exam, and people could actually recall from the classroom teaching that how that question has to be approached. In ophthalmology, the key high-yielding topic were extraocular muscle actions, diabetic retinopathy, glaucoma drugs. So they were high-yielding in this exam. in microbiology, the questions were based on the applied and the clinical microbiology. The stress was more on the practical aspect of microbiology, like vaccine, medium, pathogenesis, biomedical waste management. These were the things that they had stressed upon. And I also want to introduce for a future aspirant an important concept about an horizontal topic repeat or a vertical topic repeat. Because you will hear toppers will tell you that there was some repeat in the question, but they were not verbatim repeats, so you get confused. I'll give you an idea here or not. In AIIMS, the theme of topic repeat is very, very important, and the toppers are able to look at it and are able to derive from it that, okay, what will be asked in the next exam. I'll give you an idea. For example, there is a question in this exam on fundus fluorescein exam of cystoid macular edema. Now, there are two scenarios. Suppose in the next year, they have a question on what investigation would you use for CME, or they ask you about the treatment of CME. So last year the question was on a FFA of CME. Next time they might say on treatment. So this becomes a vertical topic repeat. Or if they ask you next time FFA of another disease like diabetes or anything else, that becomes a horizontal repeat. Now, this is very critical to passing and doing well in the AIIMS exam. Very, very critical. I want you to listen to me again, that what students are doing is, if they see in one exam they have asked fundus fluorescein angiogram of CME, next time they will say, okay, I will remember all FFEs of all kind of, diseases in ophthalmology. That is, they are only targeting the horizontal thing. But you also need to look at CME and see the topic as a whole, so that you can tackle both kind of topic repeats. This is critical to, topping in AIIMS, because that analysis, and some of the students keep asking, sir, how DAMS is able to do this? We do that analysis. We do this analysis. All our teachers, we sit together, put our heads onto it. We keep looking at what topic, and this time also we have done an evaluation. We do this. This is just a, kind of a trailer of the activity that we do. We put in hours and hours of analysis, and when we try to look at all the ramifications of the questions, okay, instead of rote learning, because we know that the question repeat is not as important as the topic repeat, we go for all the ramifications, from the horizontal ramifications and the vertical ramifications, and we sculpt the course for the next year with those inputs. And that is where, we've been doing it for last 2 decades. So we are not doing what we were doing 20 years back. Now we have sculpted, changed the curriculum, we discuss, we improve. And that is the entire cycle of education. That is where the number of years we put into it, kind of, work into it, they help us into evolving further. I'll give you one more theme. This is very important for all future aspirants. All the children who are going to appear for AIIMS, who want to be there, please listen to me here. Integration. Integration was all over this paper. I'll give you some examples. There was a question which had orthopedic pathology integration, and somewhere in the choices there was Langerhans cell histiocytosis. There was a question where ophthalmology and anatomy was integrated with eye muscles and their nerve supply. There was a X-ray and a pediatric history, radiology pediatrics on a chest X-ray with a clinical scenario. We had to integrate them. There was a pediatric orthopedic radiology integration with a X-ray showing you scoliosis. So this was all over it. This is the way you have to think in the exam. And that thinking, because the toppers would be always saying it is about common sense. It's not common sense, it's about looking back and connecting the dots. So whenever we are studying in your classes, you will see that every teacher would take that attempt. Whenever teachers would be teaching, they'll take that attempt to round up their subject vis-a-vis other subjects like pathology, radiology, and they will always try to link it up, so that you get an idea on how that disease looks like to a lab science person, to a radiologist, to a clinician, and so that you are able to do a well-rounded approach. And that is the goal of the exam bodies as well. The exam bodies like AIIMS, they are looking for a candidate who is having this well-rounded approach, so that when he becomes a resident in one subject, he is not looking at it with a tunneled eye. He knows that, even if you're looking at an ophthalmology disease, it could have systemic implications. So that is the kind of theme that AIIMS loves, and this was evident in this exam as well. Integration and horizontal and vertical topic repeats. They form a big chunk of the paper. There was another question where medicine and biochemistry was integrated about electrophoresis of the proteins. So this is the theme. Another point I want to make to you is that in this paper, in this new pattern of AIIMS, the marking scheme is different for different kind of questions, which I have discussed in a previous video as well, and I'm sure you might have heard that video before the AIIMS exam. So I'm not going into it, but I just want to emphasize to you that you have to assess the risk versus benefit of doing a question. I'm repeating. So if a question has a equal ratio of positive is to negative, you have to be guarded on it. If it is more positive, less negative, you can go aggressive on it. Okay. It is different from a previous AIIMS of 2018, 2017, where there were all questions had earlier same marking scheme. I just want to make it a point that the future aspirants understand this. If you do not know this, please scroll back on the YouTube channel of DAMS and you will see a video by me explaining the marking scheme. Recently I've done it. So, but I hope you see it here that if the marking scheme is understood by you, you will be able to strategize better so that you can shift gears. This exam is asking you to shift gears in between. It is not just that I'll go on all out aggressive mode. It is not about being defensive either. You just need to shift gears based on the marking scheme, and you have to analyze the risk benefit ratio on each question. So, you know, that is the key here, that exam skill comes into the way. So you have to imbibe the marking scheme so that it is in your skill, you know, in your spinal cord level, so that you don't mess it up in the exam. And that is why, you know, I saw a lot of students actually appreciated the mock test that we had done. And I'm so glad that we could give you that practice of the real theme, real pattern of the exam. And that is what we strive for. What else? Now, this is something that I want everybody to note. There were no controversial questions in this paper. There were no uncalled for topics in this paper. So, you know, I hope you see that, you know, a lot of people would tell you that, you know, doing more and more things would help. But actually speaking, if you look at the AIIMS exam and if you have time, look at the last 3-year papers, they've hardly put unusual things. They're not going at, you know, unusuality. It's all about, you know, there are no uncalled topics or no controversies in this paper. So I want you to, you know, get it in your mind that, you know, sometimes the truth might be so simple that you might be missing out on it, you know, because some children will say, sir, I want to get into AIIMS, I want to do something complicated, I'm, you know, buying all the resources in the world. But at the end of the day, it is about what you learn in your classroom, the concepts that you build up, the notes that you make. That basic philosophy remains the same. Whatever the world might change, you know, trust me. Now, suppose now, I'll give you an example, you know, all of you doctors would be able to understand it. Suppose I ask you, what do you need to stay healthy? In the today's world of complicated world, people will say you need a wearable, you need a watch which is calculating how much you walk, how much you sleep, how much everything. You need everything. But at the end of the day, you need two things. At the end of the day, you need two things. You need to eat good. You need to, you know, exercise. You need to eat good. You don't need to, you know, don't overdo things. And those basics still remain. The world, whatever technology may come, those basics still remain. Same is true about studying. Making notes, understanding in the classroom, interacting with the teachers, those basics still remain. Okay, so don't ignore them, because, you know, sometimes in our, you know, need for fancy, we think that we need to do something fancy. We need to have apple cider to be healthy, but actually you need to, you know, eat in moderation. Similarly, you know, that is what I believe, that this exam was a great message that it is gone, that, you know, they are not going at any controversial questions. Okay. And another point I want to emphasize is that be mindful whenever you are in your, you know, college, you know, so it's very important. Suppose in your final year or your internship, you're doing some activity in the college. Be mindfully present there. When you are mindfully present there, you will observe things. Okay, you will see that, okay, why this size of cannula is being used, why this kind of a Foley's is being used, and all, what is this instrument that is being used by the orthopedic surgeon. So if you are doing something, please do it mindfully. That is again a message from this exam, That, what I see children, the problem is that, it's not that people are not going into wards or people are not doing intensives, not like that. But whatever you are doing, you need to do it mindfully. You should be present at that point in your mind instead of just being, a robot who is just making discharges and things. You have to be mindfully there. So those kind of things also help in the exam. When we did a survey with the students and asked that what were the top resources that they could, advise to future aspirants, a majority of them said it was all about class notes, classroom teaching, understanding in the classes. That was the majority. Second resource was the AIIMS capsule that we had made, and that entire capsule was made after hours of researching into the horizontal and the vertical topics, and that probably made it very high yield for this AIIMS, and same was the feedback that we got in the May AIIMS as well. DQB, DVT, some images from DVT were there in the exam, some questions for DQB, so people actually were happy with the resource. And previous papers discussion that we had put on eMedicos, because previous papers, they are important for AIIMS, so don't ignore them if you're a future aspirant. And our emergency medicine course that we had put on eMedicos were top resources, top rated resources that the students found most useful for this AIIMS exam. So if I put everything together for you, integration, don't run after fancy, stick to the basic idea of working hard, making concepts, understanding things, developing your common sense. Whenever you're in the hospital, be there mindfully. Try to be that mindful person even in the classrooms. Whenever you're making notes, try to understand things, just so that when you have to apply them, you find them easy and lucid for you to apply. Stick to the basic idea about notes, exam skill. Notes, exam skill. These are the two most important things in the exam. Time management, variable marking scheme, integrated questions, topic repeats. These are your key strategies for a future AIIMS aspirant. This is the dream that most of you are now looking at, and I know the result would be out for this AIIMS in the next 2 days. And I really wish you all the best, and I hope you get the chance to do your post-graduation from the top institute in the country. I wish you all the best for your upcoming results. God bless you.